WEJF 90.3 FM. It's Wednesday. That means it's Helping Seniors of Brevard Day with Joe Steckler. Joe is off today, recuperating from his knee surgery, but I'm John Harper, and of course, Kerry Fink is here. Hi, Kerry.
Hello, John Harper. How are you today?
Wonderful. Couldn't be much better.
Good. Well, we've got a great radio show ahead with lots of good information. We've got amazing guests, as always, longtime friend of Helping Seniors, board-certified elder law attorney Bill Johnson is here with us. Hello, Bill.
Hello.
And then also we have from the Helping Seniors Travel Club, the CEO of Senior Travel and Travel Center USA, none other than Chris Morse. How are you today,
Good
Chris?
afternoon.
And I thought as we go into this, we take just a moment to recap. The subject for our show today, we were just talking about this. We're going to talk about, here we are. We're still in the middle of COVID. And so one of the things that we wanted to talk about was what's going on with access for visitors. And so we're going to talk about access for visitors, both as it pertains to what the restrictions and rules are now that they've announced for assisted living homes and places like that. Bill is going to bring us up to speed on that. And then we're going to talk about what's going on with access to visitors for cruise ships if they want to go traveling and what's going on with all that. So we do have a lot of good things to talk about today that I think is going to be very helpful and very informational. Wanted to give a quick update. Joe was trading emails last night, literally after midnight, with Terry Steckler, Joe's wife, who said that he'd actually had a good day. Joe is working on physical therapy. He had the knee replacement, and so they're really trying to get things going right. And, of course, everybody's up late trying to guess who the next president is going to be and all of that. So that's what's going on with Joe. The other thing we talked about was a quick recap and update on where we are with the car raffle. So, as you know, we talked about this just a little bit last week, but very fortunately, and thank you for participating and helping us in the Helping Seniors car raffle. John Harper, that was really, Joe was telling us that was really quite a successful car raffle, and he's already laying down plans that we're going to be able to announce the 2021 Helping Seniors car raffle very quickly. But, Troy Darling of Indialantic, Florida, he won this year, and he picked out that beautiful Chevrolet 2020 Camaro. In fact, it was the one that you were standing next to and doing interviews with.
I was leaning up against it, ready to drive it out of the showroom. They did open the door of the showroom. I thought this was my chance. They were moving some other cars around. But beautiful car, and he certainly selected a good one. And as you just started to mention, Kerry, this particular car raffle was the best that the organization Helping Seniors of Brevard has ever had. And I think considering the pandemic that we're going through, it was quite a turnout of support for the organization. All of it done virtually online and remotely, and we were very pleased that people did adhere to the fact that you couldn't go to the car museum, the muscle car museum, and obviously people heard us talking about it because virtually nobody showed up.
Yeah, I think we had about a dozen people, maybe 18 folks who showed up who had not gotten the word, but thank God for that. And so, that was the bad news. We had to stand outside under the portico and do the grand drawing there because we didn't, we wanted to do everything right by the book and keep people safe. So that was the bad news. We had to do that outside. We did get our winner, and he was a local winner. But the good news is Mark had promised two things. Number one, to go ahead as soon as possible to open up so that we can have our make good date, our rain check dates there, or COVID check dates, I guess is what you would say, at the American Muscle Car Museum. So make sure you hold on to your Helping Seniors tickets. There's a big party coming, and I really believe that's going to be the moment we get to kick off the 2021 Helping Seniors car raffle. Again, Joe and AJ had already started talking. I heard it's all gossip right now, but I was hearing, of course, the Chevrolet is going to be back. Of course, the Dodge Challenger is going to be back. I heard maybe a pickup truck is going to be back. So
I think we need to get a Corvette in there.
Well, yeah, then we'd have to double the price of the tickets, right? Because the car costs like 3 times as much. But it's a fun thing that we get to do. Joe and AJ go back a long way in doing these things. In fact, I heard AJ say that together with Joe, they'd raised millions of dollars for senior funds because, as you know, John, you, Bill Johnson, too, go way back with Joe, predating the Helping Seniors work, but even back to his days with the Alzheimer's Foundation. And you've seen Joe work on this for years.
I've seen him work on this tirelessly for years, yes.
Bill, over the years, you've been very supportive, not only of Helping Seniors of Brevard, but the Alzheimer's Foundation when Joe Steckler was the executive director there. And you've done a lot in the community to give back, and that's very big, very appreciative of all of us for what you do for the community. It's great.
Well, thank you, John.
Yeah, I've always enjoyed it. And folks, if you get a chance to go to the Helping Seniors of Brevard website, which conveniently enough is helpingseniors.brevard.org, helpingseniors.brevard.org, we archive everything. So all the TV shows, all the radio shows, all the articles that have been in the Helping Seniors newsletter. We're going into our 10th year. And Bill, you've been there every step of the way. And there are some tremendous resources that you have shared your knowledge and wisdom as a board-certified elder law attorney. And it's really great for people who are grappling with this stuff for the first time.
I agree, and not just me. There's dozens of other people on there talking about a variety of different subjects that affect seniors. So you can find information about legal things, financial things, healthcare, videos, and all kinds of topics.
Yeah, in fact, we just did and released a couple of TV shows that are now broadcasting on Space Coast Government TV. There was one that you did a wonderful explanation about probate. It's a word most of us have heard, but I don't know that many of us understand, and it was a great how you led us through all of that. And then we also talked about, I believe it was Power of Attorneys was the other show.
I agree, yeah. We've had a variety of shows on that, and advance directives, Medicaid, and topics like that, VA benefits.
Yeah, and lesson number 1 that I keep getting every time I watch one of the shows or I sit down with Bill is this is not the do-it-yourself project, because this could cost you tens of thousands of dollars if you get this stuff wrong.
Potentially, yes.
It's not do-it-yourself radio or TV.
No, that part's easy. There's not too much damage, but boy, when I hear some of the stories about somebody who went down to the office supply form and they thought they were doing the right thing because they spent $2 instead of, maybe just say a couple of $100 to get it done right up front, but now it's going to end up costing hundreds of thousands of dollars because they did something incorrect with a house deed or something like that. It's the horror stories go on.
That is very true, and it happens all the time.
Yeah. So sort of with that, maybe this is a good jumping in point, as we wanted to talk a little bit about these rules are changing a lot. For remember, it was supposed to be 30 days to slow the spread, and we were all thinking everything will be back by summer. And then we had really thought we were being conservative and saying, okay, let's hold the car raffle in October. It will surely be fine by then. And here as we sit, and we're in November now, and we still need to take every single precaution and be just as careful as they have taught us to be about all the recommendations about staying safe with COVID. But now we have a situation where people are trying to, there's this tug of war between opening things back up and trying to keep people safe. And I guess it's how do we walk that tight wire and without falling off on either side. And I guess one of the big challenges now is that assisted livings, and I don't know if this applies to hospitals or things like that, but one of the challenges, if somebody's an inpatient, nobody can go see them. You're on your own.
Correct. And like you mentioned, this was supposed to be 30 days. Now it's dragged on over 6 months. And we've had these seniors who've been isolated in either assisted livings or nursing homes, and their loved ones have not been able to come and visit or touch them or anything like that. And it's created a lot of depression and, other mental illness in these patients. And the despair and lack of hope and things like that is very real with these people. And so we've had to kind of walk a fine, like you said, a tightrope on what do we do, how do we get them that interpersonal contact without jeopardizing their lives. Because as you remember, initially this COVID virus went through nursing homes and killed thousands of people across the United States, and did it so very quickly, including here in Brevard. So there's been, initially I think the gut check was don't let anybody in.
Right.
And that's the way it's been for quite a while. Now that recently changed. The governor issued an order, and he allowed certain classes of people and numbers of visitors to come in. And then there were certain classes of people who could actually have physical contact with the individual. Otherwise, you still had to stay your 6 feet away in social distance. And so, one of the caveats to all that is that the assisted living or nursing home couldn't have had an outbreak in the last, I think it was 14 days or so. So they had to be relatively COVID-free themselves before you could start allowing outsiders in. Well, when it came to nursing homes also have another regulatory agency that deals with them. It's called Medicare. And if you're in a nursing home getting rehab, Medicare is typically paying for most of your bill. And the Centers for Medicare and Medicaid came out with their own regulations that were different than the governor's regulations.
Wow.
And so then we had this, who do we follow? Do we follow the governor's order when it comes to nursing homes, or do we follow CMS's?
Right.
And the answer is, it depends where you live.
Wow.
Some places follow the governor's order. Some places follow the CMS order. And so we had a whole, across the state, different ways whether or not you could visit somebody. And one of the trade organizations for nursing homes called Leading Age had issued I guess some sort of email or memorandum saying that they thought that the ones you should follow were the CMS guidelines, which were a bit different than the governor's. Mm-hmm. So they've issued another email or guidance, I guess, to their membership. They're a trade organization, and they've kind of incorporated now both the governor's order and the CMS into one thing that makes it much easier for their membership to understand. Because, again, a lot of places were still not letting visitors in. Now, there's nothing that says a facility has to let somebody in. They can be stricter than, what the governor's order says. Huh. And, of course, if they've had a case, they could probably shut it all down again. And who knows where we're going with this coming in the future. I think I saw something yesterday that we had the most positive cases ever in the United States recently. So we'll see what the winter brings. And if we're going to have a strong upsurge, you may see things locked down again.
Yeah, it's interesting, Bill, because as I have done the Helping Seniors updates, which are the little things that we do online on social media where we talk to different people connected to helping seniors in various capacities around the county, just kind of getting a feeling for what's going on out there. And I've been personally very encouraged talking to those who go into seniors' homes, that they talk about the fact that if they follow carefully all the universal precautions, meaning the PPE, all the hand washing, all the things that are recommended by CDC, they're not introducing COVID. And I've heard the same almost universally from every single assisted living that is connected with helping seniors, where I've talked to them and said, how are you guys faring? They said, we've been able to, thank God, stay COVID free. And I remember when that first order that started to say, well, maybe certain visitors can come in, that's when those people started getting nervous, because they said, we're careful. We're going to, we're testing, we're doing all these things, but now you're introducing a lot of unknowns. And I guess that's maybe where kind of the danger point is about being careful with all that.
Yeah, I went on a little vacation out to the west to the national parks, and flew on an airplane. You had to wear a mask. You had to go through certain requirements. They sanitized the whole plane, and everywhere we went, anytime we were inside somewhere, and the requirement for most of those states were if you were inside, you had to have a mask on. We did our hands and with hand sanitizer and things like that. Now, I know another attorney who did probably the same identical trip, did the same things we did, and came down with COVID.
Yes.
So I don't know necessarily what the answer is, but certainly it seems like if you let your guard down for just a minute, you may have a problem.
Yeah, and that's one of the things that as we got a lot of stuff we're going to cover today. We're going to talk a little bit about how this impacts the travel industry. So I'm glad you actually brought that up, because that's one of the reasons that we asked Chris Morse from Travel Center USA, who's also our partner with Helping Seniors Travel. We've been trying to get our Helping Seniors Foundation cruise off the ground, and I guess it was the CDC or the cruise lines just made some determination that they won't actually start sailing now, at least through maybe the end of December, right?
Yeah, the CDC came down and said they have all the rules and regulations. All the cruise lines said they would adopt them. All the cruise lines now have canceled all of their cruises through December 31st. But the fun part is the CDC has allowed them now to start sailing with crew.
Mm-hmm.
So they'll take a crew out, go around the island a couple times, come back.
Mm-hmm.
They'll go through all the CDC checkpoints, testing on board the ship, testing again, cleaning the cabins, etc. Then the next step is they're going to invite all the employees of the cruise lines to go out as passengers.
Mm-hmm.
That would be the second test. They'll go out, go around the island, come back, they'll do the testing, they'll do the whole thing. And then they're going to invite all the travel agents to go out, complimentary, go around the island, come back. And if they've passed all their tests and everything has gone well, then they'll open it up to regular passengers. And we're looking for probably beginning of January, mid-January, when they'll start that.
Okay.
So we're really excited. It's time to cruise.
No, we're all ready for that. And I think you told me too, Chris, that MSC Cruises, who is our partner for the Helping Seniors Foundation cruise, they've actually already been sailing over in the Mediterranean, right? Because I guess the rules can be different, and that seems to be going successfully.
They have had 14 sailings now, 14 7-day sailings. And all the passengers have gone through all the CDC testing, they've all adhered to all the rules and regulations, which is really good. The passengers are doing what they're supposed to do. They have not had one COVID incident. The only incident that happened, it was on a riverboat cruise, and none of the passengers adhered to the rules and regulations, and half of them got COVID.
Wow.
Because they didn't follow the regulations. They weren't wearing the mask that much. They didn't use sanitizing gels. They didn't do what they were supposed to do, and half of that population got COVID when they came back. It was a very, very small ship. It was only 56 people.
Yeah, Bill, what does that suggest to you? I would almost say, is there anything we can learn from the cruise ships, because they're desperate to get back? I can only imagine what it costs them to just hang around waiting. but like we're talking about, there's the financial cost of waiting, but then there's also, like you mentioned before, the human cost of waiting, because if somebody happens to be in a hospital, assisted living, their wife, husband can't come see them, their kids can't come see them necessarily, and you've got all these complexities. And even like you said, it's even maybe not even clear cut who can visit and who can't and when. Because it sounds like it's somehow connected to what the individual place decides too.
To some extent, yeah. And I thought maybe we should just run through what
Yes,
these things
let's do it.
are. This is, from Leading Age, this is their hybrid document. But the core requirements they're saying is outdoor visitation is allowed at all times during visiting hours, that the facility should establish a visitation policy, establish a limit on the number of visits, length of visits, and visiting hours based on ability to screen, ability to monitor visits, and the size of the space designated for visiting. Conduct screening based on temperature, signs, symptoms, and exposure to COVID-19. Maintain a visitor sign-in and sign-out log. Face coverings or masks and appropriate PPE are required. Hand washing and or use of hand sanitizer is required. Social distancing between visitors, residents, and staff is required. Instructional signage throughout facility and visitor areas. Limit visitor movement within facility. Visits should be conducted in a designated space if the resident has a roommate. Appropriate cleaning and disinfecting of high-touch and visitor areas with cleaning and disinfecting between visits. Provide training on visitor policies, infection prevention and control, and proper use of PPE, and obtain signature of visitor acknowledging training and receipt of policies. Recent test result documentation of visitors may be encouraged but not required. Facility must pay for testing if it requires for entry. Maintain adequate PPE for staff. Restrict or revoke visitation if there are attempts to mitigate concerns the visitor is unable to adhere to infection prevention control requirements or other COVID related. Now, there's several other caveats.
Yeah.
Not allowed indoors if a new facility onset a COVID-19 positive case within the past 14 days.
Mm-hmm.
Not allowed indoors if community positivity rate is over 10% based on CMS data. Obviously, that's for nursing home only.
Right.
Not allowed indoors if facility is conducting testing because of outbreak. Not allowed if resident to be visited is COVID-19 positive or in quarantine. Visitor must wear face masks and appropriate PPE. Social distancing required with resident. Requires adequate capacity at referral hospitals. Compassionate care visits, which are also an exception, allowed regardless of community positivity rate, allowed regardless of facility onset of COVID-19 positive cases, allowed regardless of whether resident is COVID-19 positive or in quarantine, allowed at all times during visited hours, including evenings and weekends. Visitor must wear surgical mask and PPE to healthcare workers, appropriate to healthcare workers. No social distancing required with resident. CMS, nursing home only, touching for a limited time is permissible. And P&P must describe designation and utilization of compassionate visitor. I think that's your paperwork. But,
right.
So there are, and compassionate care visitors fall into several categories according to the governors. And usually it's, somebody's bad off mentally and they need somebody for moral support. That's part of it. And also if somebody is a primary caregiver, somebody who comes in and is responsible for, massaging their loved one or, some other reason they need to touch the person. So those kinds of exceptions to the social distancing are there.
Wow. Well, it sure is a lot to digest in all that, and we're going to keep the conversation going. I think we're about down to our mid-show break, John Harper, and we'll be right back with more of Helping Seniors Radio coming up.
Helping Seniors of Brevard. As we get back to the show, we've got Kerry Fink with us. I'm John Harper. Kerry, an esteemed panel of guests, as always, here on the show. An interesting topic going on, so why don't you go ahead and take it back.
Thank you, John. Yes, we are standing in the presence of greatness. We have board-certified elder law attorney Bill Johnson here, and also a travel expert. Chris, you have been doing this since 1982. So this is certainly not your first rodeo. You've been through a lot of things in the travel business.
Well, we've been through so many things like 9/11 and
Yeah.
some of the hurricanes and some of the other sicknesses that we've had, and the World Tower and all kinds of things going on that has just slowed the travel industry down. But Kerry, starting in February, March, it's going to be time to cruise.
Yeah, everybody is. Actually, what we were talking about the outset of the show is still the challenge. Everybody is amped up and ready to go because we've been trying to do the right things for so long, but we're kind of getting what do they call it? There's a word for that when you go cabin crazy or cabin fever or whatever. People really do want to get out. It's part of who we are and what we like to do. And so the question that we've been talking about all show is how do we deal with visitors? And we've been talking about it from two sides. We've been talking about it from the side of what if you want to go visit mom or dad or your relative who's in a senior facility. So that's number one. And number two is how do we go and talk about this as far as we want to visit other places, like we want to get back to traveling, and how do we do that safely? And as you heard Bill talk about in the first half of the show, he had a good and successful travel out west, vacation time with all the precautions, still had a good time. And yet we both know somebody who did the same thing and fortunately came through it, but came down with COVID as probably a result of that travel. So how does this work out, or how do you see us returning to travel safely, Chris?
Well, the cruise lines are going to do their 100% utmost to make sure we're safe to go on board a cruise ship. And here's some of the things they're going to be doing. Normally, when you come up and you stop and you get your luggage out of your car and you give it to the porter,
right,
he will be wearing gloves and masks. Mm-hmm. And he is supposed to be required to change the gloves every 5 times that he does it, use gel, put his gloves back on, and then goes back and helps the clients. When the client gets to the front of the line, they're going to be tested with a thermometer, a portable thermometer.
Right.
If they pass, they will be allowed to go into the main hallway. Mm-hmm. And most of the cruise lines now are going to do touchless check-in. Okay. They're trying to do that. Or you walk up and there'll be somebody there, you give them your reservation number, it'll click on, it'll see your face, you'll be able to go right on the ship, you get your cards, you go right on the ship. Every passenger will be tested every other day. They'll all be required to have masks and gel when they go into the common areas, which would be really good. The crew will be tested every day. When they get up in the morning, when they get to their shift, they'll be tested every day. Same thing will happen when they get into the ports that are open. They'll be tested as they come back into the ship. Again, thermometer, gloves, gel. And they're going to make it just as simple as possible so it doesn't kind of ruin the cruise atmosphere that we like to know. And since our Helping Seniors of Brevard Foundation cruise has been changed from February to May now, I'm thinking there'll probably be a vaccine available prior to our cruise, so maybe those restrictions will be lifted a little bit, but if not, it'll be very safe, sound, secure. You and I are going to be on that cruise,
Absolutely.
Celebrating the ability to actually get away, go to some beautiful islands, have a great time, and stay safe.
Yeah, I think that's the thing. I think you made the observation once that, as these cruise ships go back to sea, not only legally, but probably responsibly, they're going to make sure it's cleaner than your own home, I
Absolutely.
think. And is this true? I had read where you're not supposed to go off gallivanting around on ports of call on your own. They want you to stay with a group because that's sort of your bubble that they know is COVID-free and things. So they've got a lot of ideas that are designed to keep people safe but still enjoying the places that they go.
And I was really glad to hear what Royal Caribbean did. I think it was Royal Caribbean, it may have been Princess. But you're not allowed to go off on your own. You have to stay within the excursions that the cruise lines produce for you, which are all pretty good.
Yeah, they're all usually great.
There's one couple, they went on their own. They tried to get back on the ship, and they were denied boarding. Now, insurance doesn't cover that, so now they're in some port, let's just say Cozumel, for example. Now they got to get themselves back home.
Wow.
So the cruise lines are doing exactly what they're supposed to do, and I felt bad for the clients, I felt bad for the passenger, but I felt really good that the cruise lines are actually doing what they say they were going to do instead of, giving in to the client, which cruise lines normally do for common sense. But they denied boarding. The customer had to get back on their own back into the United States, and I was so glad to hear that.
Yeah, that kind of goes back to what Bill Johnson was talking about a little bit earlier when we were talking on the healthcare side. You said that actually it's up to the actual institution itself. Even though there's some guidelines, they could choose to be stricter if they wanted.
Well, I was going to say I've been denied boarding at some assisted living facilities and nursing homes. Right when we had the outbreak, obviously everything went to lockdown.
Right.
And we were trying to get in there to help people do their estate planning documents, their powers of attorney, advance directives, and things like that. And we couldn't get to those folks. And there was a big problem. And we, us and the facilities kind of worked together to improvise. And I think we talked about it, how do you get documents signed when you can't get in there to get somebody to sign them? And we talked about where they would roll people up to the window. We'd send the documents in, they'd sign it, and then everybody would witness through the window, the person sign it, and then they come back out. And that works fairly fine. And then more recently, they've set up areas now within the facility where they'll bring a person to, and they either have plexiglass or, a 12-foot table where you're 12 feet away and things like that. So they've now set up some designated areas. But, when the governor issued his order saying who could come in and visit with somebody, nowhere on that order was your attorney.
Yeah.
and especially if you're facing a possible life-ending situation or something that could leave you incapacitated for a period of time, maybe on a ventilator even.
Wow.
It might be good to have that person's legal documents and affairs in order before things get to that stage. And I was glad to hear, I think it was last week, that the governor's order has been modified a little bit now to allow attorneys in for that particular purpose.
Yeah, I remember you and I were talking, I think it was a radio show earlier in the year, and you were explaining that even though digital signatures and things were now starting to come into play in certain cases, which you would think would make it easier in the nursing home scenarios and environments, you explained that by the very definition of seniors being considered vulnerable adults, that didn't work in that case.
Correct. And it was kind of interesting. We put so many safeguards in there for so vulnerable adults don't get exploited. But, one of those safeguards was that if you needed assistance with your activities of daily living, a digital signing was not one of the options available to you, which, of course, covered anybody in an assisted living and nursing home. That's why they're there. They need assistance. So even though we could do digital signings after July 1st for a lot of the big documents, we could not have or could not use it to cover this particular instance.
Yeah, and that was, to me, that was kind of fascinating because I remember early on in the lockdown, you were deemed, as an attorney, you were deemed an essential business for obvious reasons. The processes of life move on, and you have to be able to help people get, different things moving, whether it be, like you said, health care documents or whatever.
Yeah, and there were a couple exceptions. The federal order that the governor referenced, which is actually a Department of Homeland Security document, defines what essential businesses are, and why they didn't explicitly say lawyer. Mm-hmm. There were several instances of things that we do, especially at my law firm,
right,
that we fell under, including senior housing, which we do a lot of work in getting people, assistance mm-hmm. assisted living or home health care or nursing home care, and then there were several other categories that we fell under. Whereas, if I was your personal injury attorney, I still probably couldn't have stayed open at that point. So there's some people who do what I do who have been closed since March. They've been working out of their homes.
Wow.
So
well, it's an amazing thing. So generally our topic for the day is we're talking about the fact that now that we're trying to open things up a bit and trying to walk this fine tightrope, I guess I would say. It's like a high wire act. We're trying to be safe and do all the things that keep us physically out of harm's way, and at the same time not isolate so far that we're putting ourselves, I don't know, for lack of a better way to put it, mentally in harm's way.
Right. And for somebody like me, at least, a big part of what I love to do is travel.
Right.
So I'm glad to hear that and I've taken quite a few cruises. I'm glad to hear that, that people are getting on board with that kind of thing and making it safe for people to do so.
Yeah, and that's what I was going to ask you, Chris Morse, with the Helping Seniors Travel Club. Just by way of a real quick introduction, the Helping Seniors Travel Club was an idea that Joe Steckler had almost from the beginning of the entire Helping Seniors organization. He said, because even then he was concerned about isolation for seniors under a good set of circumstances, let alone what 2020 has given us. And so he said, he recalled kind of fondly this travel club that one of the radio personalities in this area had done, which became sort of like an annual event. Everybody wanted to go sailing with this guy because not just because of him being a great personality, but also because you're traveling with friends. You get on a cruise ship or a travel experience and you meet all these wonderful people from all over the world. And then you maybe become Facebook pals, but it's even better when you meet somebody from your hometown because now you can go have lunch when you get back, right, Chris?
That's one of the things that seniors love about cruising. I have been on over 120 cruises, and I probably have made a couple of hundred friends, but I can tell you, anytime I take a cruise, I can send an email out, and about 50 people will go with me because we enjoy each other's company. We're all over 50, 60 years old. We enjoy going to the different ports, having the different dinners together, doing all the different activities that the ships give us opportunities to do. So it's a lot of fun. And all of that, if we can then support the Helping Seniors of Brevard Foundation, the cruise lines that we work with, all of the major cruise lines, they have all promised us that they would donate back part of their profits to the Helping Seniors of Brevard Foundation so we can then continue to support the seniors that need help in the Brevard County area. And I thought that was just fantastic. And since we match or beat any rate that you can get online or with any other form of booking travel, please give Helping Seniors of Brevard and Senior Travel an opportunity to book your travel so then we can donate back to Helping Seniors of Brevard Foundation.
Yeah, and I want to make that clear. The idea of the Helping Seniors Travel Club is this isn't something you join or you have to pay any money to become part of. This is just, if you're going to book your travel, give Chris or Betty a call, because whatever you saw on the internet, two things will happen. They are able to match that, but better still then, Lord forbid you run into any kind of headaches or things, you're not going to be 1-800 something for the next 10 years while you're trying to sort it out. You have a travel agent who is on your side trying to help make sure that we get anything resolved. So, Chris, how do people get in touch with you guys?
You can call Chris or Betty at 321-978-5211. And there's a cute little story I tell Kerry. When you get on board a cruise ship and you walk on board and you're all excited and you see this line at the concierge desk about 80 or 90 people long,
yep.
Would you believe that probably 89 of those 90 people have booked online and something went wrong? Only one person booked through a travel agent, and that was a mistake. So always use a travel agent. Always give Senior Travel and Helping Seniors of Brevard Travel Club the benefit of at least trying to book your cruise. And again, if you would call 321-978-5211, Chris or Betty will take your call all the way up to 11 p.m. Eastern Standard Time.
And I was going to say the other advantage you get is that you are sewing into the Helping Seniors organization. Joe was effective at creating an endowment for the Brevard Alzheimer's Foundation. Today they operate the Joe's Club. They still call them Joe's Clubs to this day. And so Joe has always had the same idea that we need to create an endowment, a foundation that can support the work of helping seniors going into the future. And this is kind of a great, fun way to kick all of this off is through the travel side.
Kerry, we're going to test Chris and see if he answers the phone at 11:30 at night.
Oh, okay.
Absolutely.
He said up to 11 o'clock. We'll try it at 11:30.
Well, I actually, knowing Chris, I believe he would. But, the thing that I wanted us to just all talk about for a minute is, the idea of traveling is a fun one. And the idea of traveling on a cruise ship, I always think, is one of the best opportunities that you can have for traveling. It's like being in a great hotel. Your hotel wakes up in a different city every day. All your meals and stuff are there. And, if I thought about it and I wanted to be trusting of the choice of venue that I would take from a cruise for a vacation first thing out of COVID, I think I would trust the cruise lines because they have so much at stake. They're not going to mess this up. They're going to do all the things to make sure that we're able to cruise safely.
Chris, you mentioned all of the amenities that are offered on the cruise that is upcoming, that's being offered for the organization. Everybody's always interested, I think, in the food and the what type of chef the particular ship has. What can you tell us about this ship and the chef and what they're known for?
Each cruise line has its own special chef now that goes into creating all the differences. So MSC, being an Italian cruise line, they have a couple of great Italian chefs. I wish I could pronounce their names, but I can't. But they actually do the menus, make sure that the food comes out looking the way it's supposed to look. Half the battle of serving food is how it looks when it's on the plate, rather than how it tastes.
Sure,
so
the presentation.
Oh, and the Italians do that so well. So when you're on the MSC cruise with us in May, you will get fantastic food. They actually serve 9 meals a day that you can eat if you want, anywhere from pizza to little snacks to 3 main meals to ice cream cone socials in the afternoon. I mean, it goes on and on and on and on because it's an Italian ship. And if any seniors out there love wine, come and join us because we'll have some great Italian wine also.
That sounds great, especially the wine, and that's going to be worth checking that out. Chris, what about the seating for the dinners at night? I know a lot of ships have experimented with alternating the dinner times or whatever. What do you know about this particular one?
They're going to keep the dinner times the same, but you'll be able to get a table for 2 for a couple, a table for 4 for a family. And those large tables of 8 will be split up into tables of 4. So you could actually have a larger family, but you'll be social distancing between the 2 tables. So they're going to make it very safe. They'll still have the buffets, but instead of you reaching out to grab the food, the server there will have gloves on. They'll be constantly using gel, and they'll be serving you. So you can go choose your food at the buffet, but they'll be serving you on your plate, which is really fun. And, of course, any of the other areas where you would grab for food, there'll be a server there to serve your food for you. So it's going to be very, very safe.
Is there still a captain's dinner on this one?
There always the captain always has a formal night kind of thing. Sometimes it's food, sometimes it's cocktails, where you can visit the senior staff and the captain. We won't be able to shake hands anymore, but those elbow bumps, I guess, are now or
high five or whatever.
Italians like to wave, so they've been waving a lot, maybe.
Wait a minute, which finger are you holding up?
So it'll be a lot of fun. Yes, they still have the captain's gala.
That's always fun. Is that a black tie event?
Not anymore.
Really?
It used to be, 10 years ago, we would bring our tuxedos and we would all dress up. But as the Americans get a little bit older and a little bit younger, maybe 1/4 of the population on board a ship now will wear a tuxedo. one quarter will wear fancy dresses and suit and ties, and the other ones will just be business attire.
I'll still bring my black tie.
Absolutely.
Yeah.
Yeah, that way you're extremely elegant on board.
It's fun to dress
Absolutely.
up once in a while, and why not do it on a cruise ship?
Sure.
Makes great photos, right?
It does. It does. Good way to go. Yeah.
So, Chris, so you are open for business. You're booking travel now for 2021. How do people get in touch with you?
The cruise lines are experiencing record-breaking bookings for 2021 and 2022 because people want to go and they want to travel.
A lot of pent-up demand.
Absolutely. And since cruising gives you all-inclusive rates, including all the meals and all the shows in your hotel room, a lot cheaper way to go. So please call us. Reach out to us at 321-978-5211. We'll take real good care of you. We'll tell you all about the May Helping Seniors of Brevard Foundation Cruise, which will be a lot of fun. We're going to have a multi-generational cruise in August for those seniors that want to take their not their sons and daughters, but their grandkids out before they go back to school. And we'll have some great opportunities in 2022.
Yeah, so it's going to be a lot of fun, the Helping Seniors Travel Club. And you can always find out more at helpingseniorstravelclub.com. But kind of zipping us back, I wanted to also ask Bill Johnson, our elder law attorney, and I guess also you're probably getting to be a travel expert if you've done a lot of these cruises and things as well. But I wanted to ask you, how do people get in touch with your office? I know you are like the leading expert on all this kind of information when it comes to the paperwork that seniors ought to be thinking about. In fact, you publish a book or booklet, I guess is probably more the correct term. It's about a senior legal guide. I forget the exact title of it, but it is a great tool. You distribute that in the Boomer's Guide a couple of times a year and make sure that seniors have access to all this good information.
To get a hold of my office, it's 321-253-1667. That's 321-253-1667. And we do hand out those books. They're called the Florida Long-Term Care and Nursing Home Answer Book. And we give those away for free.
It's really important because I was thinking about the amount of seniors who are turning 65 for the first time this year here in Florida, and the population keeps growing. People are moving in. So it's very important that you get schooled in this so you don't get caught by surprise on any of this. And I think we're actually at the end of our time for today, so I want to thank you, Bill Johnson, elder law attorney with William A. Johnson, and also you, Chris Morse, with the Helping Seniors Travel Club and Travel Center USA for joining us. And we'll see you, John Harper, next week on the radio.
Kerry, I'm ready to go cruising.
Let's do it.
Yeah, let's make that happen. Okay, thanks so much, gentlemen, for being with us on this Wednesday edition of Helping Seniors of Brevard. Again, the program can be heard every Wednesday, 12 noon to 1 o'clock, right here on 90.3 FM.